Hello everyone. Paracetamol poisoning is one of the important drug poisoning that you should know for MBBS, NEET PG and INI-CET exam. Now let us discuss one important nomogram which will tell you whether the patient will need the N-acetylcysteine for the treatment of paracetamol poisoning, and the name of that is Rumack-Matthew Nomogram. Before watching this video, you should learn about the basic details of the paracetamol and easy tricks to remember about the paracetamol poisoning, and the link for that video is in the description box. So let us discuss in today's video about the Rumack-Matthew Nomogram. Now this is the clinical scale which is used to assess the risk of hepatotoxicity in cases where there is a single acute paracetamol ingestion and when the time of ingestion is known. Only in these cases you can use this Rumack-Matthew nomogram to assess the risk of hepatotoxicity. Rumack-Matthew nomogram you cannot use in case of the supratherapeutic ingestion of the paracetamol, in case of the chronic poisoning by the paracetamol, and when the time is not known. So in this condition, you cannot use Rumack-Matthew nomogram. Now here you can see this is the Rumack-Matthew nomogram. On the x-axis hours post ingestion, and on the y-axis you can see the plasma concentration of the paracetamol, which is usually expressed in terms of microgram per ml. Now here you can see one treatment line. This is the treatment line and that is at 150 microgram per ml. Now, if the plasma concentration of the patient is above these treatment lines, means if it is more than 150 microgram per ml at the time of 4 hours, then it indicates that there is a risk of hepatotoxicity and you have to immediately start the N-acetylcysteine. So, if the plasma concentration of the drug is on or above the treatment line, then you have to immediately start N-acetylcysteine, and this you have to plot at least about 4 hours post ingestion. It is important to plot this graph only after 4 hours of ingestion, because before that it is difficult to detect the peak level of the paracetamol. So you must know the time since the ingestion, and it should be only single acute ingestion of the paracetamol. Now let us discuss one MCQ. A 25-year-old woman presents 6 hours after ingesting 20 gram of the paracetamol in a suicide attempt. Her serum paracetamol concentration as shown as a dot on the Rumack-Matthew nomogram lies above the treatment line. What is the next best step? Activated charcoal only. Repeat serum paracetamol level after 4 hours. Start N-acetylcysteine immediately. Observe for 24 hours. As we have discussed, if the serum paracetamol concentration is above this line, then you have to immediately start N-acetylcysteine. So the correct answer here is a start N-acetylcysteine immediately. N-acetylcysteine that will replenish the glutathione store in the liver, and that will help to metabolize the toxic compound, and that is known as NAPQI. So this is the toxic metabolite which is generated by the paracetamol metabolism in the liver, and that will be detoxified when you start with the N-acetylcysteine, and that will protect from hepatic injury. Now let us discuss another MCQ. A 45-year-old man has been taking excessive doses of the paracetamol repeatedly over the last 3 days for severe back pain. His serum paracetamol concentration is 70 microgram per ml, which is the best statement regarding the Rumack-Matthew nomogram. It should be routinely used. It should be used by plotting the concentration at 4 hours. It is not designed for repeated supratherapeutic ingestion. It can be used only if AST is normal. Now here in this case you can see excessive doses of paracetamol repeatedly over the last 3 days. And as we have discussed, Rumack-Matthew nomogram is only for the single acute ingestion of the paracetamol. So correct answer here is it is not designed for repeated supratherapeutic ingestion. So that is the correct answer. So let's revise about the Rumack-Matthew nomogram. This is used for single acute ingestion and only in cases where the timing is known. Interpretation you can do by plotting the concentration of the paracetamol against the time, and the minimum time for nomogram interpretation is 4 hours. If the serum concentration of the paracetamol is above the treatment line, immediately you have to start with the N-acetylcysteine. So this was about the clinical scale Rumack-Matthew Nomogram, which is commonly asked in the NEET PG, INICET, and as well as in the FMG exam. If you like this video, then subscribe my channel and follow for more such pharmacology related videos. Thank you.